Prostate health, a sensitive topic for aging men. As a man enters his 60s, his body begins to change, quietly, gradually, yet profoundly. There are no alarms, no dramatic shifts, but the small signals accumulate, affecting everyday life. One such change centers around a small gland, the prostate. The prostate, a small walnut-sized gland beneath the bladder that produces seminal fluid, often goes unnoticed during youth. But as men age, this gland tends to enlarge, a condition known as benign prostatic hyperplasia, BPH. This is one of the most common issues affecting senior health, especially in the realm of aging men's health. Though small in size, the prostate plays a crucial role in male reproductive health. Most men are unaware of its existence until problems arise. With age, hormonal changes, especially involving testosterone, can significantly affect this gland. By age 50, nearly half of all men show signs of prostate enlargement. By age 80, that number rises to 90%. The statistics are striking, yet the topic remains largely unspoken, as it involves urination, sexual function, and deeply personal issues of confidence. Have you ever felt like you can't completely empty your bladder? Do you wake up multiple times at night to urinate? These are classic symptoms of an enlarged prostate, hallmarks of BPH. Many older men dismiss them as a normal part of aging, but they are not. When the prostate grows larger, it presses on the urethra, the tube that carries urine, making urination weak and difficult. Some experience urgency, incontinence, or even blood in the urine. Left untreated, these symptoms can lead to complications like urinary tract infections, bladder stones, or kidney damage. The challenge lies here. Many aging men feel embarrassed to talk about prostate health. They suffer in silence, thinking it's the cost of growing old. But senior health should never mean silent suffering. It demands proactive care, attention, and understanding. Avoiding conversations about urination or sexual issues often delays diagnosis. By the time men seek help, the condition may have worsened, affecting both physical and emotional well-being. This may be the most sensitive part, but it's one that must be addressed. Prostate issues can affect erection, ejaculation, and overall sexual satisfaction. Many older men become withdrawn, less confident, or even depressed due to these changes. But this isn't the end. With proper guidance from healthcare providers, medication, hormone therapy, and, most importantly, open communication with partners, sexual health can still be meaningful and fulfilling. Prostate health in elderly men isn't just a medical issue. It's essential to their emotional and relational well-being. Today, treatment for prostate issues has progressed significantly. Depending on severity, men can benefit from lifestyle changes, reducing fluid intake before bed, limiting caffeine and alcohol, and staying physically active to improve urinary function. Medications are available to relax the prostate and bladder muscles, easing urination. In more serious cases, minimally invasive procedures or surgery like laser therapy or TURP, transurethral resection of the prostate, offer relief. Regardless of the method, one truth remains: don't wait until it's too late. Proactivity is key to maintaining aging men's health. Although benign enlargement doesn't lead to cancer, prostate cancer can develop silently. That's why experts recommend PSA, prostate-specific antigen blood tests, starting at age 50 and earlier for men with a family history or African American background. Early detection can save lives, prevent suffering, and protect long-term senior health. Daily routines can support prostate and urinary health, especially for older men. Simple habits like pelvic floor exercises, Kegels, maintaining proper posture during urination, avoiding straining, eating a diet rich in vegetables and fruits and low in red meat, and managing stress all make a difference. Anxiety affects hormone levels and urinary function. Consistent, small actions accumulate and create long-term change. Mr. Thomas, a 68-year-old retired engineer from Colorado, experienced symptoms for almost a year: frequent nighttime urination, fatigue, and declining mood. Embarrassed, he avoided the doctor until one day he fainted in the bathroom. His family rushed him to the hospital. The diagnosis: an enlarged prostate with urinary retention and mild kidney strain. After 3 months of medication, pelvic exercises, and dietary changes, everything improved. Today, he speaks openly to his peers. Getting old is hard, but staying silent is harder. The prostate may be small, but its impact is immense. Senior health is about dignity, awareness, and proactive action. There is no shame in speaking about your health, your body, or your emotions. Aging doesn't mean losing control. It means taking charge of your well-being in a wiser, more informed way. Aging isn't the end. It's a chapter of deeper awareness and an opportunity to live fully with care, respect, and understanding. As men age, hormonal imbalances, especially declining testosterone, become more pronounced. This doesn't just affect libido or muscle mass, it impacts energy, mood, sleep quality, and prostate function. Lower testosterone and increased estrogen activity contribute to prostate growth and inflammation. What was once a quiet gland becomes a troublesome one. Hormonal balance isn't just for the young, it's a lifelong responsibility. Addressing it through hormone testing, lifestyle changes, and medical therapy under professional supervision is part of modern senior health. Men from different cultures deal with prostate health in different ways. In some Asian countries, older men may feel ashamed to talk about bodily changes. In Western countries, despite better awareness, barriers remain. By encouraging stories like Mr. Thomas's, we break down taboos and promote healthy aging conversations. Dr. Stephen Monroe, a urologist in Chicago with over 25 years of experience, says, "The biggest challenge isn't treatment, it's getting men through the door. Once they come in, 90% of cases are treatable without surgery. Early action brings better outcomes." Some exercises help build pelvic muscle strength and improve bladder control. Start with basic Kegels. Tighten your pelvic muscles for 5 seconds, then release. Repeat 10 to 15 times twice a day. Light squats and deep breathing exercises improve pelvic circulation. Movement isn't just mobility, it's medicine. The emotional impact of losing control over urination or sexual performance is profound. It strikes at the heart of masculinity and dignity. Many older men feel less like a man, leading to withdrawal, anxiety, and depression. Emotional support, counseling, and open dialogue can help restore mental health and self-worth. Aging doesn't mean going it alone. The role of a spouse or partner is crucial. Many men delay treatment because they fear appearing weak or losing intimacy, but most partners just want honesty. Facing prostate health challenges as a couple builds connection and trust. Nutrition plays a powerful role. Foods rich in lycopene, tomatoes, selenium, Brazil nuts, and zinc, pumpkin seeds, support prostate health. Avoid excess red meat and alcohol. Incorporate leafy greens, fatty fish, and plenty of water to reduce inflammation and support longevity. Here's another real-life story. Joseph, a 73-year-old Vietnam War veteran in Florida, ignored his symptoms for 2 years. A routine checkup at the VA clinic revealed early-stage prostate cancer. After surgery and 6 months of hormone therapy, he's now in remission. Today, he volunteers to educate other veterans about prostate screenings and senior health. Common myths must be debunked, that urinary issues are just aging, that sexual dysfunction is permanent, or that treatment always requires surgery. The truth is, modern medicine offers many gentle, effective options. Speaking up is the first and most powerful step. In the end, prostate health is more than a medical matter. It reflects how we age, with awareness, courage, and care. Men deserve to age with dignity. They deserve to live without shame or silence. And they deserve to thrive, not just survive, through their golden years. Take action, ask questions, get screened, and above all, talk about it. Because senior health is not just about living longer, it's about living better.